Hi, Dr. Wellner here. You may not know this, but 1 in 8 women experience breast cancer in her lifetime. 1% of all breast cancers occur in men, so men are not let off the hook from this terrible disease. Receiving a breast cancer diagnosis can be terrifying and emotionally overwhelming experience. Many patients don't know where to start or even what questions to ask. And so many fall through the cracks, especially socioeconomically disadvantaged patients. I've seen that in my 20-year history as a medical professional, and I'm here to try to make sure that doesn't happen to you or your loved one or anyone else in this society. Let's start by keeping it light. What are breasts? The topic of the human breast spans a series of complex biological, psychosocial, and cultural facets. Breasts are mammalian glands or modified sweat glands that evolved to nourish offspring. A prominent historical theory suggests that in many cultures, larger breast size equated to increased fertility, health, and beauty, while in other cultures, smaller breasts are of higher social value. Undoubtedly, the female breast has represented a major cultural and sexual symbol over the years, influencing art, history, and identity. But before incorporating those various elements, which naturally have either a direct or indirect effect on breast health, let's talk about what breasts actually are. Now, some of this may be simple and you already know, but some may be new information. Breasts are an important part of the human anatomy, generally located on the chest. The origin of breast tissue occurs during fetal development from a structure called the mammary ridge, or the mammary line, which runs along the sides of the body from the armpit to the groin. In some mammals, like cows and pigs, there are more than just 2 breasts that form. In humans, the majority of the mammary ridge regresses during embryogenesis, leaving 1 paired gland at the chest level. Breasts are generally a combination of the following. 1. Glandular tissue. The breast gland produces milk from the lobules, and that milk is carried out of the breast to the nipple via ducts. Secondly, the breast consists of connective tissue. Also called fibrous tissue, connective tissue supports the architecture of the breast, allowing it to stay in place. The next element is fat. Fatty tissue dictates the size and shape of a breast. The amount of fat in the breast varies from person to person, accounting for the wide variation we see in the appearance of people's breasts. The nipple is a specialized structure where milk is released during breastfeeding. The areola. This is the darkened or hyperpigmented area around the nipple, which contains small glands called Montgomery glands that help keep the nipple moisturized and protected from dryness, cracking, and infection that can occur during breastfeeding.